So these are the basic categories of pH imbalance that we will see in the body. Remember that acidosis is any time that you have a pH that is less than 7.35, and alkalosis is any time that you have a pH that is greater than 7.45. Now we can categorize these as either being respiratory in nature or metabolic in nature. In general, if it's respiratory, it means the issue is with the respiratory system, whereas if it is metabolic, it's something else. Usually, if it's acidosis, there's a fixed acid that is the issue, for example. You can use labs to figure out what's going on here. And so I'm going to draw a little diagram because we can measure different parts of the blood, and we can figure out if we are in metabolic or respiratory acidosis versus alkalosis. So first of all, if you look at the pH in these, it's going to be decreased in respiratory and metabolic acidosis and increased in respiratory and metabolic alkalosis. So looking at the blood pH is going to give you an indication of whether it's acidosis or alkalosis, but it's not going to tell you whether it's respiratory or metabolic in nature. So how do we figure that out? Well, we can look at the partial pressure of CO2, so a blood gas, and we can look at bicarbonate levels, bicarbonate ion levels. If it's respiratory in nature and you have a decline in pH, then the decline in pH is due to an increase in partial pressure of carbon dioxide. The reason that the blood is acidic is because of an increase in carbon dioxide, possibly because the person is not ventilating appropriately. So hypoventilation has led to this. So hypoventilation. Now, if you look at their bicarbonate levels, they may be unchanged or normal, or you might actually see that they're increased. And the reason that they might be increased is because the kidneys are compensating for the elevation in the partial pressure of CO2 by creating more bicarbonate ions to buffer the blood. Now, so you would only see an increase in bicarbonate if the respiratory system, if the renal system was compensating. Now, on the other hand, if the situation is metabolic in nature instead of respiratory in nature, and you have a decline in pH, then the decline in pH is not due to an elevation in the partial pressure of CO2. So that may be normal. If you look at the blood gases, the partial pressure of CO2 may be normal. What's going to definitely be abnormal is bicarbonate, and it's your buffer, right, that buffers acids, and it's not doing a good job, so it's declined. And there's a variety of reasons for that. Maybe you're generating a lot of metabolic acids like ketone bodies or lactic acid, and they're using up all the bicarbonate. Or maybe the kidneys aren't working and they're not regulating bicarbonate levels as they should be. But in any instance, the bicarbonate levels are reduced in metabolic acidosis. Now, partial pressure of carbon dioxide in metabolic acidosis is either not changed or it can actually be reduced as well. And if it's reduced, this means that you know that the respiratory system is compensating. And if you saw it reduced, you would also expect to see the person is hyperventilating. So if a person comes in and they're hyperventilating, they have a decline in bicarbonate levels and a decreased partial pressure of carbon dioxide. The reason they're hyperventilating is to try to breathe off extra CO2 to compensate for the lack of bicarbonate in the blood. Now we can measure these things in alkalosis as well. So partial pressure of carbon dioxide or bicarbonate, and figure out whether we are in respiratory or metabolic alkalosis, where the pH is elevated. We have a decline in hydrogen levels there. So during respiratory alkalosis, there's really only one cause, and that's hyperventilation. So if a person's breathing excessively, if they're having a panic attack, then what you're going to see is a reduction in CO2 levels. That's the cause of the alkalosis. So bicarbonate levels may be unchanged in that situation, or you might see a decrease in that buffer. Because you don't want the buffer to absorb acid, you want acid levels to increase. So you don't want that buffer doing that. During metabolic alkalosis, when you have a rise in pH, a decline in hydrogen, you're going to see a change, always a change in the bicarbonate levels. This is what's causing it. And during metabolic alkalosis, you're going to see an increase in bicarbonate. A lot of times this could be due to taking too many Rolaids or Tums, because that's actually calcium bicarbonate, and that can cause metabolic acidosis, that can cause metabolic alkalosis. And then if you look at the partial pressure of carbon dioxide during metabolic alkalosis, it will either be unchanged if no compensation is happening, or you can actually see that it is increased so that it can add more CO2 and more acid to compensate. So take home here is metabolic. The metabolic is caused by a change in bicarbonate levels. Respiratory is caused by a change in partial pressure of CO2 levels. The secondary effect is always compensation. So here we have compensation. This is compensation. So those are all the circles are compensatory reactions, where if the kidneys aren't working well, for example, in metabolic acidosis, if this is a kidney issue, you can hyperventilate to reduce volatile acids and compensate by reducing another acid in the body.